Alrighty, so first of all, it's wonderful to be a member of this department. I used to be the only non-surgeon that would speak, but I see Bill Meehan speaking today, so I'm the second non-surgeon that's speaking. And what I thought I'd do is I'd tell you about some of the stuff that we're doing in the lab with the goal of trying to address whether cell death causes arthritis or whether arthritis causes cell death. And I know many of you know the answer to this question already, but I'll show you how we've been thinking about it and how the technology we're using is going to help us address other sort of questions that are relevant to pediatric skeletal disease. So I'm going to tell you about a new method for studying mouse articular cartilage and why mice. So mouse cartilage looks very similar to human cartilage. Here's the surface of the cartilage. Here's the intermediate layer, the deep layer, the subchondral bone in a human. Here's mouse, superficial zone chondrocytes, intermediate, calcified cartilage, bone underneath. But notice the difference in the scale there. That mouse cartilage, relative to human cartilage, is minuscule in size. Though, even though it's much smaller, because mice are much smaller, if you look at the thickness of mouse cartilage relative to the weight that mice have to support in their joints, it correlates with all other species. So here would be human, here's mice, here would be elephants. So cartilage in mice is designed to do, presumably, what cartilage in humans is supposed to do, but it's harder to study. It's harder to study for a few reasons. One is because the mice are so small, even if you do a micro CT, as we would do a common CT in human patients, to study mouse cartilage by micro CT takes about 10 hours of CT time. And you can't really get micron level resolution as you would need. Similar for micro MRI. You can pretty much see structures in the joint, just as you would in a human joint, but this takes hours of imaging. So the gold standard really for studying mouse cartilage is to do old-fashioned histology. So here's a sagittal section through the knee joint, femoral condyle, tibial plateau, the meniscus over here. And this is really dependent upon how good the sectioner is and how many sections you can do. A mouse joint might be 1 millimeter across, and this is 1 5-micron slice. So you really need 200 slices to get a good idea of what's going on in the entire cartilage thickness. Time-consuming, expensive. So Minji Zhang in the lab worked out a technique to use a confocal microscope to study larger amounts of mouse cartilage. Now, the mice have to give their life for this, so it's not an in vivo test yet. But essentially, one could take out a humeral head, a femoral condyle, put it on a glass slide so that the surface of the cartilage is abutting the slide. And here's just a section to give you a sense of the proportion. So here's the microscope slide. Here's the joint. And you could just use a confocal microscope to take sections going deeper and deeper into the joint. And you could capture about 760 microns, or 3/4 of a millimeter in one direction. You can go easily 100 microns deep. And you could count all the cells in this region, and there's a fair number of cells. So for example, this is the femoral head of a mouse going, again, about 60 microns deep. Every nucleus now in that mouse cartilage, we've put a white dot in, so we can count the number of nuclei. You could determine the volume of that cartilage that you've imaged, and you can count the total number of cells per the total volume. And there is, in a mouse femoral head, there's about 2,000 cells, 2,000 chondrocytes in what we've imaged. You could just say, well, okay, I don't want the whole thickness. Maybe just give me the 10 microns from the very top, the surface chondrocytes, the ones that provide lubrication via the production of lubricant and hyaluronic acid, for example. So you can count the total number of cells at the surface divided by that volume. Or you could say, well, let me just take a plane of cartilage, 10 microns below the surface, 20 microns, 30, 40 microns below the surface, and count the number of nuclei right there. So we have several measures of chondrocyte sort of quality or cartilage quality using this. And here is just, I think this was for the lateral condyle. So for example, the global density, the total number of chondrocytes per 100th of a cubic millimeter averages about 9,700 or 2,000 total in a mouse. You get pretty good standard deviations. And the key point here is if you want to see a 30% difference in any of these values, you need relatively few animals. 4 animals, 3 animals is sufficient to see a 30% change. Now, if you want to see something more subtle, a 10% change, well, some measures are still very sensitive. Others take more mice, but it's not going to break the bank, and you'll get meaningful data out of it. So we've developed this technique. We think it's robust. It's reliable for studying mice. You can get meaningful data using relatively small numbers. So the questions we've used this technique to address are, if you kill cells, does that cause arthritis? Because as we age, we lose chondrocytes. As we age, we have increased risk of osteoarthritis or developing osteoarthritis. They're correlated, but does one cause the other? Is the loss of chondrocytes a cause of osteoarthritis, just as the loss of brain cells might be a cause of dementia? And the second thing is, if you damage your chondrocytes, do they have an ability to regenerate? So this is the first experiment that we did. It's a complicated slide, but I'm going to walk you through it. Essentially, for the aficionados, these are the mice that we used, but I'm going to explain the experiment. We took a mouse in which we could induce the cells at the surface of cartilage to undergo cell-autonomous death, meaning they die on their own without damaging the cartilage around them, because they express diphtheria toxin, and diphtheria toxin kills cells. So in the control animal, all that we did was we got their surface cells to turn green rather than red color. So the blue dots are the nuclei. The green are cells close to the surface, 10 and 20 microns below the surface in these sections, that are surface chondrocytes. And in the experimental animal, we got these cells at the surface not only to turn green, but when they turn green, they pretty much die. So you can notice near the surface, there's many fewer blue dots because the cells are dead. Those were their nuclei, and they're now gone. And there's fewer green cells. So we've killed cells at the surface of cartilage, and we've killed quite a lot of these cells. How many of you think that's bad for the mouse? Martha thinks it's bad for the mouse, and Jim thinks it's bad for the mouse. Well, it's not so bad for the mouse. So we've been able to kill, so we kill the cells at about a month of age. You can see there's some cell loss at 40 days, but by 3 months, 2 months after we've killed the cells, there's half as many chondrocytes in the mice that we got to express diphtheria toxin at the surface. Here is controlled diphtheria toxin shown in cross-section. The blue cells are the nuclei. Again, the bone is down here at the bottom. You can see there's fewer chondrocytes in this one section compared to control. But look, even 9 months later, the surface of the cartilage looks pretty darn smooth. Again, there's a little bit of meniscus crossing it in between here, but there's no roughening, there's no protein deposition. And in fact, if you count chondrocyte numbers using the confocal microscope, 9 months after you've killed 50% of the cells, the cell number comes back to normal. So cell death, as a proximate thing, does not destine you to osteoarthritis, at least if you're a mouse in the short term, and mice live 2 years, so this is half of a mouse's life. Now, we showed this to Brian Snyder, and we talked to Mark Gephardt, and they said, oh, we knew this already, because if you do limb salvage surgery, and you put in a cadaveric knee into a patient that's had an osteosarcoma, their cartilage will last 5 years, even though all the chondrocytes in the replaced joint are dead. So I guess that this relatively inert substance, cartilage, can live without chondrocytes for a reasonable amount of time. Now, the other thing that was surprising to us was, again, that the chondrocytes over time come back in number, and that's because if you actually measure, using the confocal microscope, cell division, in the diphtheria toxin-treated mice, cell division occurs at 2 to 3 times the rate as in a wild-type mouse, which is what causes the replenishment of numbers. And for those of you that have looked at osteoarthritic cartilage, you can see clones of chondrocytes trying to divide and repair cartilage, but they're stuck in their little chondrogenic tomb, in their lacuna. They can't migrate through the surrounding cartilage to repopulate uniformly. And that is the same in these repaired animals. So if you were to take, again, imagine doing this in 3 dimensions, a chondrocyte, and ask how far is its nearest neighbor from it. In a healthy joint, chondrocytes are on average about 8 microns apart. The surface ones are maybe a little bit closer together. The deeper ones are a little bit further apart, but they form this very nice bell-shaped distribution. In contrast, even though the total number of chondrocytes in the diphtheria toxin exposed mouse comes back to normal, their distribution is no longer normal. There are more cells that are close together. They probably divided and they can't move apart through the thick cartilage matrix. And then there are cells that are further apart because their nearest neighbors that used to be right next to them have died and their next nearest neighbors are further apart. So these data suggest that if you don't damage the surface of your cartilage, but all you do is you kill the chondrocytes, that's not so bad. And in fact, the chondrocytes will try to come back and repair themselves, though not perfectly. Now, that's not the real world, right? The real world is something bad like this happens, in which at the time you injure your joint, the surface of the cartilage is damaged. And an animal model that's being used to sort of replicate this is a surgical displacement of the medial meniscus. If you do that in a mouse, by 1 month of age, the surface is fibrillated. And by 3 months of age, there's chondrocyte death and frank osteoarthritis. So, Martha, I guess it's equivalent at some level to the mini pig transection. So now what happens if you don't kill cells, but you just roughen the surface? And so these are now, again, images 20 microns below the surface of the medial condyle versus lateral condyle. The blue dots are nuclei. And a month after surgery, even though the surface is roughened, the number of chondrocytes is indistinguishable between the sham-operated and the operated animals. So roughening the surface in the short term does nothing to chondrocyte number, but by 3 months after DMM surgery, you can see a huge loss of chondrocytes in the medial condyle of the femur, underneath where the medial meniscus has been surgically displaced, compared to control, and the lateral condyle is untouched. So these data would suggest that damaging the surface of cartilage is an antecedent of cell death, but cell death is not necessarily an antecedent to surface cartilage damage. So what's the relevance of this? Well, Brian and Martha both said the 15-year survival rate following cruciate injury to be arthritis-free is about 50%. Brian, I think, intimated was maybe 20% arthritis-free survival. Elite athletes, nearly 100% arthritis, right, as a result of trauma. Even in the genteel sports, golf, Tiger's had his hips and knees injured. Jack Nicklaus had both hips done, I think. So I think elite athletes, and now from Dr. Wenger's lecture this morning, childhood athletes that are doing more than they should. Maybe they are roughening their cartilage. It may take 10, 15, 20, 30 years for that cartilage to fail, but it's going to fail. And that's because once a surface is roughened, cell death is inevitable. So I'm going to summarize this, then I just have 3 more slides. So the summary is, this technique is very cool. We're applying it to a lot of other questions in mice about what allows cartilage to form, maintain itself. Killing cells doesn't immediately cause cartilage damage, but causing cartilage damage pretty immediately kills chondrocytes. So now I just want to turn to the idea of, are mice enough? Because this was, again, a question raised whether we should be experimenting in humans versus mice. So do we need better models to study degenerative joint disorders? And again, mice have nice cartilage, but it's much smaller. And this comes up because of this patient and patients like him. So this is Buddy. I think Buddy was 12 years of age when I met him. This would have been his hand x-ray when he was age 8. This was a perfectly normal looking knee MRI at age 12. At age 18, both knees had been replaced in Buddy. And at age 17, his femoral head was replaced. And this is what his femoral head looked like. Anyone want to hazard a guess as to what his disease is? No one? So this is progressive pseudo-rheumatoid dysplasia. It gets its name because the swelling of the PIP joints looks like rheumatoid arthritis, but it's completely non-inflammatory disorder. It's an autosomal recessive disease. It's due to deficiency of a protein called WISP3. 100% of patients, or near 100%, have their hips and knees done before they're 20. Many have perfectly normal-looking joints at age 8, so there's something going on from age 8 to 20 that we don't understand. By 40, elbows, hips, elbows, ankles, shoulders are often getting replaced as well. So this is an important disease to study because one patient is probably costing the healthcare system $1 million or so. Add to that disability and above and beyond it. The problem is when you knock this out in mouse, there's no phenotype at all. So mice don't need this gene. Humans need it. But of course, it's very hard to go to your patients when their joints look this good and ask them for cartilage to study. And by the time their joints look like this, their cartilage is indistinguishable from an 80-year-old with common osteoarthritis. So we can now make genetically modified pigs, so we just don't have to surgerize them to induce a phenotype. We can genetically change them. We can give them Stickler syndrome due to collagen mutations. We can knock out WISP3, and we can study them. This is a typo here. Adult weight is about 75 kilograms. So they can be like an average human adult. They live 17 years in contrast to mice that only live for 2 years. The only con side to the pigs, as best I can tell, is one, if they're genetically modified, you can't eat them because of GMO rules. And you have to keep them in a special farm. And they cost about $6,000 per pig per year to maintain. So I would love to talk with you guys about whether we should be making genetically modified pigs at this cost. What can we do to learn about fundamental principles of skeletal biology and therapeutic strategies? So with that, I'm going to thank predominantly Minji Zhang, who pioneered all our confocal imaging and did the experiments that I told you about, and our funding sources, which is NIH and HHMI. Thanks a lot.